Hello friends, in this video we are going to discuss some important topics which are going to be important for your upcoming medical PG entrance exams from pediatrics. So in any typical medical PG entrance exam you have approximately 12 to 15 and it even goes to 20. Yes, you have almost 15 to 20 questions usually from pediatrics, okay? And pediatrics is a very easy and straightforward subject. So if you have a good command over your basics, if you have done your important topics really well, it becomes a very scoring subject for you. So let us see some important topics which you must revise and you must be thorough with them before appearing for any of your exams. Okay. So first, starting with general pediatrics. So in the growth chapter, you need to have an idea about, the normal growth, how normal growth happens. So, you should be able to interpret the anthropometric parameters provided. So if you're provided with a growth chart, you should be able to plot on it and you should be able to interpret it. So interpret the anthropometric parameters provided. Okay, anthroparameters. And you also need to know a little bit about short stature and the important conditions where you get short stature, like achondroplasia, familial short stature, constitutional delay of growth and puberty. Okay. Apart from that, you also need to have some idea about dentition, the development of teeth. You get a lot of, questions related to the development of milk teeth and the permanent teeth, like, which teeth is the first one to erupt, the total number of teeth in milk teeth, the total number of teeth in permanent teeth, the tooth which is last to erupt, the important causes of delayed dentition, okay? And Hutchinson's teeth, of course, has come n number of times, okay? So you need to know Hutchinson's triad of congenital syphilis, right? Now, from the development, the important developmental milestones in each domain, which we have already discussed in, in the main as well as the rapid revision videos. So, the important developmental milestones you must be thorough with. And this is a volatile subject and will require, multiple revisions. And apart from that, you need to know the developmental implications of these important milestones. What does this milestone indicate? So the developmental implications of important milestones has been asked in the INI-CET exam once. So you need to have idea about it. Okay. Now, moving on to nutrition and malnutrition, some of the things which are very, very important is the comparison between breast milk and cow's milk. Okay. So, how is breast milk different from cow's milk? And what are the vitamins which are deficient in breast milk? We know vitamin D and K are deficient in breast milk. In cow's milk, vitamin C is deficient and calcium is deficient. So, you need to know about, the peculiarities of breast milk versus cow's milk, the advantages that breast milk has for the baby. We need to know about the micronutrients, okay, the micronutrients and the signs of their deficiency. Okay, so micronutrients and the signs of their deficiency, like, vitamin A deficiency, very, very important. Recently also you got an image-based question where bite hot spot was there. The therapeutic dose of vitamin A which is required in various age groups, less than 6 months, 50,000 units, then 6 months to 12 months, you have 1 lakh units, and beyond 1 year, you have 2 lakh units. So the dosage of vitamin A again is very important, okay? Apart from that, vitamin B complex, you need to know the signs, the aphthous ulcers, the stomatitis, the glossitis, pellagra-like rash. So various features of vitamin B deficiency, like B1 deficiency causing thiamine deficiency, causing beriberi. So the micronutrient deficiencies, then pyridoxine, an important cause of neonatal seizures. So all this you need to know about. Okay, apart from that, vitamin D deficiency, of course, rickets is a very, very important topic. Okay. And then vitamin K, you can get case scenarios of vitamin K deficiency bleeding as well. So micronutrient and the signs of their deficiency is very, very important. In the INI-CET pattern again, there was a question on zinc deficiency, acrodermatitis enteropathica case scenario was there. Okay. Another very important topic that you get from this chapter is SAM, severe acute malnutrition. N number of times in the NEET-PG exam, you have got questions on the definition of severe acute malnutrition, the complications of SAM. Okay, so very, very important to have an idea about severe acute malnutrition. Okay. Apart from that, two very important terminologies and the clinical features related to these conditions, kwashiorkor and marasmus. Again, you've got a lot of case scenarios and you need to remember and should be able to diagnose these from a given case scenario. They're important salient features you need to remember. Like in kwashiorkor, the child has apathy, poor appetite, edema is there, hepatomegaly is there, and all these are not there in marasmus. Okay. Now moving to fluid and electrolytes. So from this chapter, you need to know how to calculate the normal IV fluid, the normal maintenance fluid required for children. You need to be able to calculate. Okay. Now apart from the IV fluid maintenance, you need to know a little bit about the management of shock in children. So initially you need to know that you need to give IV boluses of normal saline, and then gradually we move on to inotropes, and then in catecholamine resistant shock we need to give steroids as well. And if you're suspecting septic shock, antibiotics are also required. Okay. And you also need to know the composition of various fluids that are used, composition of various IV fluids like normal saline, ringal lactate, isolite P and all that. You get questions from it. Okay. And of course, the electrolyte abnormalities, the ECG changes of hypokalemia and hyperkalemia are very, very important. The important causes of metabolic acidosis and metabolic alkalosis, again, you need to be aware of. Okay. Moving on to genetics. So from genetics, very, very important is examples, important examples of different kinds of inheritance patterns. So examples of various kinds of inheritance patterns like, the autosomal dominant, the autosomal recessive, the X-linked dominant, the X-linked recessive. Okay, so you need to know the important examples of each of these categories, which we have discussed already with the mnemonics, and you get direct questions. Again, it has come n number of times in the NEET-PG pattern questions. Okay, so very, very important. Now, apart from this, some genetic syndromes are very, very important, like the Down syndrome, Turner syndrome, okay, Down syndrome, Turner syndrome, Fragile X syndrome. Again, you've got in the INI-CET pattern. You have got questions on this previously. Okay, so Fragile X syndrome. Apart from some other dysmorphic genetic syndromes that you need to know about. Okay, Marfan syndrome is again another important one. Williams syndrome is also important. Okay, and you also need to have some idea about the genetic investigations like karyotype, like fish fluorescent in situ hybridization. Okay, so some important investigations also you need to be aware of. Right. Now moving ahead to inborn errors of metabolism. Now among the inborn errors of metabolism, the disorders of carbohydrate are very important, like the glycogen storage diseases are very, very important. Glycogen storage diseases, including, so the most important ones are the Von-Giarke disease, okay, the Von-Giarke disease, Cori disease, and how to differentiate between these two. Then Pompe disease is important, and McArdle disease again is very important, okay, which is the most common disease, GSD in adolescents, okay. So glycogen storage diseases. Apart from that, galactosemia, various times in the INI-CET, you've got case scenarios on galactosemia. So galactosemia and hereditary fructose intolerance again are also very important, okay. Now, among the amino acid disorders, the important ones are the disorders of ketone, so phenylalanine metabolism, like the phenylketonuria, okay, tyrosinemia, alkaptonuria, okay. Apart from that, other important disorders like of the amino acid group are, multiple carboxylase deficiency, where biotin is supplemented, okay, and maple syrup urine disease, okay. Now, apart from that, lysosomal storage disorders are very important, and in that group, particularly Gaucher disease, again, n number of times, both in your NEET-PG as well as INI-CET, you've got case scenarios on Gaucher disease. Gaucher cells in pathology, very, very important. So Gaucher disease and various types of mucopolysaccharidosis. And so these are, must do topics which you cannot afford to miss from the inborn errors of metabolism. Now moving on to vasculitic disorders, two most important vasculitic disorders which have been often asked from pediatrics are the Kawasaki disease. This is a disease which is particularly common in the pediatric age group. The clinical diagnostic criteria, very, very important. So Kawasaki disease, and again Henoch-Schönlein purpura is another disease. So recently, in your INI-CET pattern question, there was a question on the treatment of Henoch-Schönlein purpura. Case scenario was given, you had to diagnose Henoch-Schönlein purpura and point out that steroid is used in its treatment. So Henoch-Schönlein purpura is very, very important. And many a times in the INI-CET pattern question, again, you've got case scenarios on juvenile dermatomyositis. Okay, juvenile dermatomyositis and juvenile idiopathic arthritis, JIA, is again also important. Okay. Among the infectious diseases, very important are the diseases where you have fever with rash. Again, n number of times you've got case scenarios on varicella, on measles, and the long-term complication of measles also you need to be aware of, that is SSP. You've got questions related to that multiple times, okay. So fever with rash, including hand, foot, mouth disease, okay. rubella. So all these are very, very important. Then you have another important, COVID again is important among the infectious diseases. Tuberculosis in children again is very important. Congenital infections are very, very important, like congenital, congenital syphilis, the clinical features, congenital toxoplasmosis, congenital rubella. So these are very, very important. Okay, congenital CMV. So TOJ group of infections essentially. Okay, right? And a little bit also about HIV in children. Okay, what investigation to use when, and about the treatment of HIV in children. So these are some very important infectious diseases about which you should be aware of. Okay, so from immunization, you should be aware about the latest national immunization schedule, which we have discussed in detail in our videos. So the latest national immunization schedule, and we also need to know which vaccines are recommended by the Indian Academy of Pediatrics in addition to what is present in the national immunization schedule. What are the vaccines which are recommended to be given in the adolescent age group? What vaccines are required to be given in the travelers? Okay, and we also need to know about the vaccination in special situations. So vaccination in special situations, like, how to vaccinate an unimmunized child or a partially immunized child. So we need to know about that. We need to know how to vaccinate a child who is immunodeficient, like, a child with nephrotic syndrome who is on steroids. So how to vaccinate that child. So immunocompromised child, the vaccination again is very important. Recently in, the INI-CET pattern question, you got a question on that. Okay. And very, very important again is the open vial policy. In the NEET-PG pattern questions also, 2 times consecutively you've got repeat questions on this open vial policy. So we need to know what is the open vial policy, which vaccines follow the open vial policy, which vaccines do not follow the open vial policy. So that is very, very important. Okay. So these were some important topics from general pediatrics that you must do before your exams. Now moving ahead to some topics from neonatology, which are very, very important. So they are the characteristics of a normal term neonate or at birth. So characteristics of a normal term neonate and characteristics of a normal preterm neonate. N number of times again you've got questions related to it. You might be asked all of these are normal in a term neonate, except then you've got recently in the NEET-PG pattern question, you've got a question on till how much time the baby should pass urine after birth. So a baby was there who had not passed urine in the first 24 hours of life. What do you do next? So you reassure the baby, because sometimes the babies may pass urine. The first urine might be passed sometimes after 48 hours. Okay. So characteristics of a normal term neonate. Then you need to know about the neonatal resuscitation protocol, particularly about the bag and mask ventilation. You need to know that, ventilation is the most important step in resuscitation of a baby. And what is the best indicator of effective ventilation? It is the improvement in heart rate. Okay, improvement in heart rate. Then n number of times in the NEET-PG pattern as well as in the INI-CET, you've got questions on the contraindication of bag and mask ventilation, that is the congenital diaphragmatic hernia. You've got questions on the ratio of chest compression is to positive pressure ventilation. Okay, that is 3:1 in neonates. That is again very, very important. Now, amongst the diseases of newborn, neonatal hypothermia, very important is the kangaroo mother care. What is the indication, and what are the benefits of kangaroo mother care? What are the components of kangaroo mother care? So the components of kangaroo mother care and the benefits of kangaroo mother care. Now, among the various scores in neonate, the APGAR score is very, very important. So APGAR score and the Silverman score. So you've got, in the INI-CET pattern as well as the NEET-PG pattern, you've got case scenarios where you have been given to calculate the APGAR score or the Silverman score. So you need to know, and the interpretation also you need to know. So suppose an APGAR score is given, you need to interpret that what is the interpretation if the APGAR score is so and so. So these scores are very, very important. Respiratory distress syndrome, again, to pick up from a case scenario, and the management also again is very important. So respiratory distress syndrome, a lot of questions come. So it is about the surfactant also, the various components of surfactant, and about the X-ray in respiratory distress syndrome, the X-ray findings in other diseases of newborns like meconium aspiration syndrome. So these are very, very important. Okay. And about antenatal steroids. So antenatal steroids, what is the dose of antenatal steroids has been often asked. So the dose of dexamethasone and the dose of betamethasone, and what are the benefits that antenatal steroid has for the baby. So these are very, very important. Now, apart from that, neonatal sepsis is another very important entity. You may be asked the components of sepsis screen. You may be given a case scenario where you may be asked what to do next. And so about the investigations, and you may be asked about the most common organism responsible for neonatal sepsis may be asked. The steps of hand washing may be asked. Okay. So neonatal sepsis again is a very important topic. Now, apart from that, you also have, neonatal jaundice is very, very important. So the causes of neonatal jaundice, the various causes of neonatal jaundice, and the treatment of neonatal jaundice is again very, very important, especially the phototherapy. You need to know everything about phototherapy, the mechanisms by which it acts, okay, and how to increase the effectiveness of phototherapy, the most important effective wavelength for phototherapy, and what are the adverse effects of phototherapy. What are the situations or indications of phototherapy? So you need to know about that. You need to know about erythroblastosis fetalis. You often get questions, and how you also need to know from a given case scenario, how do you distinguish whether it is physiological jaundice of newborn or pathological jaundice, okay? And when do you decide to treat the baby? So very, very important. Neonatal jaundice, almost everything from neonatal jaundice, very, very important, especially the treatment part, including phototherapy, okay? Necrotizing enterocolitis, again, you can get case scenarios, and X-ray findings can be there. So this again is very, very important. Okay. So moving ahead to systemic pediatrics. So from pediatric cardiology, the important things are fetal circulation. Especially you need to know that umbilical vein is the one that carries oxygenated blood and not the umbilical artery. You need to know the significance of single umbilical artery. Then you need to know a few things about umbilical cord and delayed fall of umbilical cord. You need to be able to arrange the structures of fetal circulation in, descending or ascending order of their oxygen saturation. So you need to know where is the most oxygenated blood, where next. So fetal circulation, it is very, very easy if you are once able to understand how it happens. So I'm sure watching the videos, you will be able to understand them. Now, from the, congenital heart diseases, the chest X-ray findings in various congenital heart diseases, very, very important, which we have discussed. Okay. And apart from that, case scenarios relating to diseases like, case scenarios relating to coarctation of aorta, where you get feeble pulses in the baby, and you get some X-ray findings like notching of inferior margin of ribs, Vicar of 3 sign, that is important. Tetralogy of Fallot again is a very, very important condition. Very important. What are the 4 components of TOF? What are the auscultation findings in TOF? What are the chest X-ray findings? Okay. And about the shunt surgeries and the management of cyanotic spells. Okay. The medical management of cyanotic spells. And what happens in cyanotic spell. Okay. So that is very, very important. Another important topic from pediatric cardiology is rheumatic heart disease. You need to know the diagnostic criteria. Okay. From a given case scenario, you should be able to pick up whether it is rheumatic heart disease or not. And you also need to know about the secondary prophylaxis of rheumatic heart disease. You've got recently a question in the INI-CET pattern on this secondary prophylaxis of rheumatic heart disease. From pediatric hematology and oncology. So from the hematology part, important are chronic hemolytic anemias, very, very important. You get questions from particularly 2 types. One is thalassemia and another is sickle cell disease. So these 2 are very important. Sickle cell disease, recently in both your NEET as well as INI-CET, you had questions from sickle cell disease. So you need to know how to diagnose it, the investigations required, and also a little bit about the management, the most common organism responsible for infection in sickle cell disease, and thalassemia, about the iron chelation part and all. The treatment part is important. The investigation parts are very, very important. Apart from chronic hemolytic anemia, you have got case scenarios in your recent exams on aplastic anemia, where you get pancytopenia without hepatosplenomegaly or without organomegaly. Okay. Now, apart from that, you get questions related to iron deficiency anemia you need to know about. Okay. And then apart from anemias, you need to know about bleeding disorders like ITP. Okay, ITP case scenario, very, very important. Idiopathic thrombocytopenic purpura. Hemophilia, very, very important. A lot of times in both your NEET-PG pattern and in the INI-CET, you've got questions related to hemophilia and related to, diagnosing it as well as management. So hemophilia remains a very important topic. Okay. And also apart from ITP, Wiskott-Aldrich syndrome, a couple of times in the INI-CET and the NEET-PG pattern, Wiskott-Aldrich syndrome has been asked. And what happens to the immunoglobulin levels in Wiskott-Aldrich? What is the typical triad in Wiskott-Aldrich? You need to know about. Now, from oncology part, acute leukemias are very, very important. Okay, you need to be able to diagnose acute leukemia from a given case scenario. The drugs used in the treatment of AML as well as ALL, very, very important. Then Langerhans cell histiocytosis, you should be able to diagnose from a case scenario. And again, the drug which is used was asked once in the NEET-PG pattern exam. Now, apart from that, other tumors which are important are, you need to know a little bit about retinoblastoma. Sometimes you get questions from it. Okay, and brain tumors, the CNS tumors, which you must have discussed in your pathology as well. And of course, the Wilms tumor and neuroblastoma. Wilms tumor and neuroblastoma, the salient features you need to know about. The clinical features, mainly how to diagnose from a given case scenario, the usual presentation, okay, and of course the radiological findings as well. Moving to pediatric gastroenterology, the important topics which we must be aware are: one is esophageal atresia, along with tracheoesophageal fistula. So from a given case scenario, you should be able to diagnose where a newborn presents with excessive frothing and inability to swallow. And if you insert a NG tube, it gets coiled in the upper neck part. So esophageal atresia you need to be aware of. You need to be aware of the congenital hypertrophic pyloric stenosis. So about the diagnosis of congenital hypertrophic pyloric stenosis, the electrolyte abnormalities, the management, the clinical features, all of them are very, very important, and number of time questions have come from it. Okay. Apart from that, you need to be aware of intersusception case scenarios and, the radiological findings of intersusception. Very, very important. Celiac disease again is very important. A lot of times you've got in the INI-CET pattern as well as the NEET-PG pattern, you've got case scenarios from celiac disease. So you need to know the diagnostic criteria for celiac disease, the case scenario in which you'll suspect it, and the management, which is the gluten-free diet. Okay. Now, apart from that, very, very important is diarrhea in children. Okay. So the most important is acute diarrhea, and persistent diarrhea is also sometimes asked. So acute diarrhea as well as persistent diarrhea. So in acute diarrhea, the treatment part is very, very important. We know the etiology is mostly viral. The treatment part is very, very important. That means plan A, plan B, plan C, how to prevent and how to treat dehydration. And apart from that, you need to add zinc. So the management of and assessment of dehydration in a child with diarrhea is again very, very important. So how do you assess dehydration? From a given case scenario, you make out how much dehydration is there and you decide about the therapy accordingly. And the composition of WHO-ORS, the osmolarity of WHO-ORS, very, very important. And also Resomal. Okay, Resomal is the rehydration solution for malnourished child. How to treat diarrhea or dehydration in a malnourished child, again also very important. Among the pediatric respiratory disorders, what is often asked is croup has been asked multiple times, the NEET-PG exam as well as the INI-CET. The case scenario where you should be able to diagnose croup is important. The radiological findings are important, and the treatment of croup is very, very important. Okay. So croup is a very important entity. Apart from that, you need to know the most common organism responsible for various types of respiratory disorders, like most common organism for croup, for epiglottitis, for bronchiolitis, for pneumonia. So most common organisms responsible is important. Okay. Apart from that, you need to remember the IMNCI guidelines for acute respiratory infection in children. So when do you call it pneumonia? When do you call it very severe disease? When do you call it no pneumonia, cough and cold? And also, the treatment part is important. Apart from that, cystic fibrosis, you often get questions related to its clinical features and diagnosis. So that is important. Bronchial asthma also, you get sometimes questions especially related to the diagnostic criteria. Okay, how much improvement is there with bronchodilators, how much should be the diurnal variability, and so on. Recently, in again the INI-CET pattern question, there was a case scenario on foreign body aspiration. Okay, so that again is important. From pediatric nephrology, the important topics are the nephrotic syndrome and nephritic syndrome, very, very important. In fact, everything about nephrotic syndrome, including the case scenarios, the complications, the treatment, everything is very, very important. The various types of nephrotic syndrome in children, their definitions, okay? And nephritic syndrome is also very important, the case scenario in which you're going to suspect it and how do you manage it. Okay, what happens to the complement levels? What are the other investigation findings that you get? So nephritic syndrome and nephrotic syndrome are very, very important. Apart from that, acute kidney injuries, recently in the FMGE exam also and in the NEET-PG pattern also, you got questions related to how to stage the acute kidney injury. So acute kidney injury and staging of CKD also is very important. Apart from that, sometimes you get questions on Bartter or Gitelman. So the renal tubular disorders, sometimes renal tubular acidosis. So tubular disorders, sometimes you get questions, especially in the INI-CET pattern. And you also need to know how to calculate GFR, the calculation of glomerular filtration rate using the Schwartz formula. So in the INI-CET exam, this is important for your INI-CET exam. so Schwartz formula and the calculation of GFR in children. Apart from that, certain congenital anomalies are also very important, like your posterior urethral valve, ectopia vesicae, and also conditions like vesico-urethral reflux are also very important, which are cause of recurrent UTI, urinary tract infection in children. From pediatric neurology, very important topics are the neural tube defects and other congenital malformations, okay, of the nervous system. So congenital malformations, very important, neural tube defects, the hydrocephalus and various causes contributing to hydrocephalus in children, the management of raised intracranial tension, the clinical features as well as management of raised intracranial tension in children, very important, okay. The findings of clinical features you get in meningitis, the most common organisms responsible for meningitis, very important. Apart from that, febrile seizures are very important. So febrile seizures, you need to know the definition, you need to know the various types, simple and complex, you need to know the management, you need to know the risk factors, the factors which will contribute to the subsequent epilepsy or subsequent, recurrence of febrile seizure in the children. And various epilepsy syndromes are also very important. So epilepsy syndromes which are important are like, West syndrome, and you have other syndromes like, the Lennox-Gastaut syndrome. You have the juvenile myoclonic epilepsy. So epilepsy syndromes are very important. Apart from that, the neurocutaneous disorders again are very important, like your neurofibromatosis, the tuberous sclerosis, and their diagnostic criteria are important ones. Brain death also, there was once a question related to the criteria of brain death in the INI-CET pattern, so that also you need to be aware of. Moving on to pediatric endocrinology, the important topics from pediatric endocrinology, the most important ones I would say are congenital hypothyroidism. You got a question recently in the INI-CET pattern. So congenital hypothyroidism, how to diagnose it, what are the most common causes of congenital hypothyroidism, and questions on CAH, the various types of congenital adrenal hyperplasia, how to identify them from a given case scenario are very important. Sometimes you've also got questions a couple of times on growth hormone deficiency or congenital hypopituitarism, so that also you need to be aware of, okay. Among the musculoskeletal disorders, among the muscle disorders, DMD, Duchenne muscular dystrophy is very important. Sometimes you get, questions from other dystrophies like, Duchenne muscular dystrophy, Becker muscular dystrophy. Sometimes the LGMD, limb girdle muscle dystrophy, you can get questions. Sometimes you can get questions from related disorders like spinal muscular atrophy. Then skeletal disorders, the two most important ones are the rickets and scurvy. And sometimes you can get x-rays of, osteopetrosis again, which is another important disorder. And osteogenesis imperfecta, the typical triad you get in osteogenesis imperfecta. And achondroplasia, again, we already mentioned, is again a very important disorder for you. Okay. Moving ahead to some miscellaneous topics. So amongst the miscellaneous topics, the important things are, one is about childhood poisoning. So recently there has been a trend in the NEET-PG exam, also in the INI-CET also, questions related to organophosphate poisoning, questions related to poisoning due to iron. So various types of datura poisoning. So, a lot of questions are coming from poisoning these days. You need to be aware of the important childhood poisons and their management, okay. And apart from that, you need to know the important causes of under 5 mortality in children, important causes of neonatal mortality in children. And you need to know the effect of various maternal drugs which can have effect on the baby. So these are some miscellaneous topics that you need to be aware of. Now, apart from all that we have mentioned, very important are the topics asked in the last 3-year PG entrance exams. So you must have thorough idea about those topics, not just the questions that have been asked previously, but the entire topic, because it is often the topics that are repeated and not the exact question which is repeated. So the important topics which have been important for the previous 3-year PG entrance exams are going to remain important for your subsequent exams as well. So don't ever skip out those topics when you're preparing, and you must revise these topics very well. And apart from that, of course, you have to keep working hard, and very important is to keep believing in yourself. So if you've worked hard and if you've covered all the important topics, if you put in your 100%, then there's no reason that you will not be able to make it. I'm sure you will be able to get the dream branch of your choice. You will be able to get all that you have dreamt of. You will be able to get all the success. Just keep believing in yourself, working hard, and I'm sure you'll make it. So all the very best and happy learning.